A psychological problem that causes feelings of sadness and loss of interest in activities once enjoyed is depression. It leads to a variety of emotional and physical problems that decreases one's ability to function at work and home. Its effects can be observed in behaviors as it becomes a daily occurrence in the society. Our correspondent, Paulina Aina, has more.
Depression is a common illness worldwide, with an estimated 3.8% of the population affected, including 5.0% among adults and 5.7% among adults older than 60 years. Approximately 280 million people in the world have depression. It is also a common and serious medical illness that negatively affects our one feel, way of thinking, and our one act.
Depression is one of the mood disorders. And when we say mood disorders, we mean something that has to do with our feelings, happiness or sadness. Depression has some things that comes together to form the diagnosis that we are talking about. The things are one, mood, which is that will be very low, meaning that there will be excessive sadness that is more than the one we have in normal. There's normal reaction to something that's bad. When something that's bad happens, you have the right to feel sad. But in depression, the sadness is excessive. The energy is very low. You see depressed patients, they complain that they don't have energy. Then the third thing that is the cause symptom of depression is the interest in pleasurable activities. We have things that we do naturally when we are well, when we are good, like watching football and so on and so forth. A depressed patient will lose interest in all this.
Meanwhile, lots of things increases the chance of depression, such as abnormalities in brain chemical levels lead, ongoing physical pain and illnesses, recreational drugs and alcohol, stress of the death of a loved one, upsetting events, and also isolation and lack of support.
Major things that comes together to form mental illness, which depression is one of them. Number one is the predisposing factor. Number two is what we call the precipitating factor. Number three is what we call the perpetuating factor. Let me just explain. The predisposing factors are the factors that are there in the underlying factor. For example, a young lady who was raped when she was 6, 7. At that point, there's actually, she may not be demonstrating any, she may or may not be demonstrating any psychological problem at that point. That may be a predisposing factor. Then precipitating factors are recent events that can actually lead to mental illness. For example, recent guilt, recent rape, and so on and so forth. Then perpetuating factors are factors that can prolong the psychological problem. So the cause or the causes of depression are to come from these three things coming together to form the diagnosis called depression.
The causes of mental depression. Various factors can be the cause of the depression. One, the brain chemistry. Depression is a complex mental health. When we talk about mental, we're talking about the brain. So when the brain chemistry, that is the functionality of the brain, is not functioning well or is affected, then that person can be depressed.
However, depression affects every aspect of one's life, including the way of sleeping or eating, education or career, health, and concentration, as well as one's relationships.
Major thing. Number one is the biological effect of depression. Number two is the psychological effect of depression. Then number three is the social effect of depression.
Psychological treatments have been found to be an effective way to treat depression. It helps change thinking patterns and improve coping skills to better equipped to deal with life stresses and conflicts. Also, antidepressant medication helps to prevent treatment. Meanwhile, the society should pay more attention to depressed people and show them love and care to bring them out of their fears. Paulina Aina reporting for KAFTAN TV.